So we had sort of a sense of filling in some of the blanks.
The three best things a person could do, in my opinion, taking charge, number one is to do something, actually. And what I mean by that is don't wait. You did a little bit last year. Number two, I think, would be your own advocate. Advocating yourself, in my mind, means pushing the doctor. Going to him, well, what's our plan? What are we doing? Where are we going? This isn't working. But pushing the envelope, to move forward, to get what you need. I guess number three would be don't be afraid to try new things. I mean, we're all, rookies at this, if you were. We've got to kind of realize that we're in a new world.
I think one of the most important things for families who are experiencing this disease is to remember to stay connected. It can be very isolating because it is such a rare disease, and there may not be people in your neighborhood, let alone your county or your immediate area, that have this disease, and it can be very isolating. But there is a lot of support out there, and you shouldn't hesitate to access that support. Ask for help, ask for support, because there's a lot of people out there who are ready to help you.
Tyler, our son, had been sick for about 6 years. He was having some difficulty with his muscle pain. He was having some difficulty going up and down the steps, and we knew something just wasn't quite right.
My parents realized that I was having problems with muscles and endurance and how long I could keep up with other kids and how fast I wore out. And we went to a hospital, and they did 2 muscle biopsies. They took one out of my leg and one out of my back. The one out of my leg was the one that showed up that I had Pompe.
I had never heard of Pompe disease before. I work in the medical field, and right away I even called out to some professional people that I knew, and they had never heard of it either.
They realized that I have a dilated aorta and a thickened left ventricle.
It was scary because it's not just the walking that's affected, it can be their heart and their lungs. And we did unfortunately find out that Tyler, our son, was affected with a heart condition that is related to the Pompe.
It affects Tyler in his daily routines. Through his junior and senior year in high school, he went very, very little to school. Most of his schooling was done at home through home study, which he did very well at. And the school district here in New Jersey was excellent with him. Supplied him with all the tools that he needed and the help that he needed to get through his junior and senior years.
I did find out a few months after I was diagnosed with Pompe's disease that my sisters and my parents were both being tested for it. And it came back that my parents were not. They were just both carriers, which you have to be to receive Pompe. I have 2 sisters, Molly and Abby. And Molly does not have the disease, but I found out Abby did.
Abby's a strong little girl, very strong. Stronger than Mom and Dad, and dealt with it very well.
When I first was diagnosed with Pompe disease, I was very scared, but after we talked to doctors, learned all kinds of stuff about it, I slowly became okay with it. I definitely feel like Pompe disease is not who I am who I am, but I feel like it made a big impact on my life, but it definitely didn't change me.
When we told Abby, I can remember we sat here at the kitchen table, and she was very strong, and I can remember her saying that she was glad it wasn't Molly. That, that she was going to be able to handle it much better than Molly could.
There you go, nice.
I don't feel that I have to give Abby any special treatment all the time, just like when she's not feeling good or anything from it. And other times it's kind of just normal day when she's feeling all right. We fight like most sisters, some, but then again, other times we get along really well. And we always hang out together since we're so close in age. And we do a lot of things together. Pompe, On a good side, positive side, it's actually brought us closer.
I agree with her, it definitely brought us closer. And I'm just glad like she's there for me to talk to her.
Molly, she had really a difficult time, I thought. When she found out Abby had it, she was the one that cried.
You know, people always say that Molly and Abby are like, you know, talking to 18 and 19-year-olds. And they've gotten stronger through this all.
I care a lot about the disease affecting her, so I always make sure she's all right and feeling fine. If she's not, I'll take care of her. Say if like your family, someone in your family has the disease and you're the one that doesn't, just stay positive for them and help them out as much as possible because they're gonna need your help. And never feel guilty about it because you couldn't have done anything about it.
We talk about it a lot. You know, if we don't hide anything from our children, if they have a question, we try to answer it the best we can, or we find someone who can. You know, we give them the opportunity to talk about it. As far as my husband and I, we try not to get too emotional in front of them. We take a lot of rides to a local store in the car, and our kids don't like to ride in the car, so they won't go, so we can talk and kind of have that time to be private, and we can kind of have those emotional times that we don't really want to have right in front of the children.
I had no problem telling anybody about my disease. You know, I'm a pretty open person. My friends, they were very supportive about it. They understood I wasn't going to be able to do everything I always did. So I couldn't go to amusement parks, I couldn't play paintball with them anymore, which was a big effect on my life because that was one of my favorite things to do. So, I mean, I found substitutions for it, so.
I think right off the bat, both kids were really not self-conscious about it. They wanted to know more. They wanted more information. They were both scared because they were reading about, you know, ventilators and wheelchairs and just, you know, that's tough when you're an active teenager and then you're thinking maybe 5-10 years I might be in a wheelchair. But they never really let that stop them. They were both very good about it. And Tyler even has a friend that occasionally is in a wheelchair, so he's very, very good about that. And he sees that, and he sees it doesn't stop her.
When I think about the progression of the disease, it does worry me because I do have the pain, and I can imagine the pain getting any worse because it really stopped me from doing the things I wanted to do. But I don't worry about it too much because, I mean, I gotta live my life and I can't live it worrying.
I want them to live a long, happy life. You know, I've had to change what I feel and think. I want them now to live a very productive, happy life.
Well, for my future, I would like to just live a normal life and get married and, you know, live on my own and be able to support myself. And that's my goal.
We had this diagnosis of Pompe disease in our family, and it affects the whole family. But we don't let it stop what we used to do. I mean, we might have to change how we do something. We might have to decrease the amount of time we do something, but we still continue to do everything we did before. As a family, we still go out to dinner, we still clean the house together. We didn't change our family dynamics. We don't sit around and talk about Pompe all day. You know, we talk about everything else, how's school, you know, how are things in soccer. We don't